Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namah. Akhanda Mandalakaram, Vyaptam Yena Characharam, Tatpadam Darshitam Yena, Tasmai Shri Guruve Namah. Tasmai Shri Guruve Namah. Very good morning to all of you. Today, we are lucky to have with us Professor Dr. Anand Yogi ji. He is the person who is born and brought up in the atmosphere of yoga. When we go through his CV, you will understand. But right from the beginning, because I know him personally, in 1996 or 98, there was a conference in Lonavala, and I was working at that point of time as a research officer in our philosophical theory research department. I think during that time, Dr. Anand was only about 15 or 16 years old. And the way he was dancing and the way he was playing the mridangam, the whole house, whole conference, international conference were astonished by his display and this, this mridangam and his dances. So I extend a warm welcome to him and to all the people who are connected with us at this moment on YouTube. Unfortunately, our Honorable President Madam Professor Mrs. Rajita Kulkarni ji and our Honorable Vice Chancellor Professor Ajay Kumar Singh, they is engaged with some other work. They could not attend, but they have requested me for the recording. So we'll start with, I will little bit introduce, because he is having a vast experience in this field. He is a, making the two aspects, medical science as well as the yoga. So both he is, I would say that he is the bridge of both in between medical science and the yogic science. So Dr. Anand Yogi Bhavanani is the director of Center for Yoga Therapy Education and Research, and Professor of Yoga Therapy at the Sri Balaji Vidyapeeth, Pondicherry. He is also chairman of International Center for Yoga Education and Research at Anand Ashram, Pondicherry. And he is also the director of Yoganjali Natyalayam, the premier institute of yoga, music, and Bharatanatyam in Pondicherry. As I said that he is born and brought up in the yogic atmosphere, he is a son and successor of the internationally acclaimed yoga team of Yoga Maharishi, Dr. Swami Vivekananda Giri Guru Maharaj, and Yogacharni Ammaji, Srimati Meenakshi Devi Bhavanani ji, recipient of the prestigious this DSc Yoga from S. Vyasa Yoga University in January 2019. He is a gold medalist in medical studies, MBBS, with post-graduation diplomas in both family health as well as yoga, and the Advanced Diploma in Yoga under the illustrious parents in 91-93. A fellow of the Indian Academy of Yoga, he has authored 19 DVDs and more than 25 books on yoga, as well as published nearly 300 papers. When I was looking after the Yog Mimamsa in Kaivalya Dham, when I was a editor of this Yoga Mimamsa, I was requesting him. He is not only was sending the papers for publication, but at the same time, because some of the papers were not understandable to me because they were purely scientific papers. So I was sending the papers to him, and I get a lot of help from him when I was working as a managing editor of this Yoga Mimamsa. So I thank him for all his the contributions made by him. He is a classical Indian vocalist, music composer, and choreographer. So he is all in one. So what are the sister sciences? Whether it is a Ayurveda, whether it is a music, whether it is a dance, whether it is Indian system of knowledge. I say so. We are lucky today that we have with us Dr. Anand today. In the recent years, he has traveled abroad 20 times and conducted invited talks, publications. As I said, that he is a stalwart. He is moving not only in 2 countries, but all over the world, over the globe. So many yoga conferences he has attended in UK, US, Italy, South Africa, Germany, Switzerland, Malaysia, Canada, Australia, New Zealand. No country is left. So he is honorary advisor to International Association of Yoga Therapists, Australian Association of Yoga Therapists, World Yoga Foundation, and Vivekananda Yoga Association worldwide. A recognized PhD guide for yoga therapy. He is a man. I think that he is the only person in India that he is guiding the students in yoga therapy. He is a recognized guide in yoga therapy. He is a recognized as an IYAT certified yoga therapist by the International Association of Yoga Therapists in US in 2016. It is notable that he is the first Indian to receive this honor. He has received innumerable awards and other award for his contribution. He is currently member of numerous expert committees in Ministry of Ayush, including its National Board of Promotion of Yoga Naturopathy. He is also in Scientific Advisory Committee and Standing Finance Committee and Technical Committee of the Yoga Certification Board, Expert Committee for Celebration of International Yoga Day and National Yoga Diabetes Program. He is consultant resource person for the WHO. Let me tell you all the people here, those who are connected with us, that the WHO, we both were working. I prepared the zero draft, and that zero draft was presented before the committee, in which Dr. Anand was one of the members, important members, because his role was very, very important. So this presentation was done in Delhi, in Mandarin Hotel, and in 26 to 28 February, wherein both of us were there in the hotel. So, and now that the benchmark of yoga is being finalized at the global level, and he is at present also is associated with WHO with a view to finalize that benchmark. So I think that his work, if I go on talking, it will take hours together. So I will not come in between. Once again, I extend a warm welcome on behalf of Sri Sri University and on behalf of our Health and Wellness Department Once again, I extend a warm welcome to Dr. Anand and to all the members who are joined here, connected with us. With these words, thank you very much. I may hand over the session to Dr. Anand. Thank you very much.
Dhanyavad, Sharmaji. Always, it is a great pleasure to be in the presence of my beloved elder brother in yoga, Professor B.R. Sharmaji. He is an elder brother, he is a senior, he is a well-wisher, he is a friend, he is a mentor, and someone who is a shining example of what a yogi should be. And Yogeshwar Krishna tells us, Tapasvibhyo adhiko yogi, jnanibhyo adhimadhodikah, karmabhyaschadiko yogi, tasmad yogi bhavajunah. Such a yogi is my dear Professor Sharmaji. And when he invited me to come and give this presentation today, I grabbed it with both hands and grabbed it into my heart. Because the heart is where we all love. What do we love? We love yoga. What is yoga? Yoga is our divine mother. And today, I have this opportunity Is the connection coming clear now? I think.
I thought I lost my connection.
Is my connection coming through? I had doubt there.
Now we can hear you.
Now it is. Okay, fine. A few moments, I think there was a.
Yeah. There was yeah. So you have to repeat. We could not listen you.
Oh, fine. Okay. So I'll come back to that again because I think we had a small internet. Ajkal, we have to also, along with Vigna Raja and others, we have to invoke the Akasha Devaya Namaha, internet, ethernet gods. I didn't do that. For me, Sharmaji represents what a yogi is. And Lord Krishna's message, Tapasvibhyo adhiko yogi, jnanibhyo abhimadodigaha, karmabhyaschadiko yogi, tasmad yogi bhavajuna. That yogi to me is my dear B.R. Sharmaji. So when he invited me, I said, I must join you. I must be with you and share my love, my life, which is yoga. This morning, I'm going to be putting my talk into two parts. The first part will look at Yoga Chikitsa, the application of yoga as a therapy within a modern medical setting, because we are working here at Saita of Sri Balaji Vidyapeeth in a deemed to be university, which is a healthcare university. So we have the opportunity to bring yoga therapy into the modern healthcare system. And I wanted to share that with you as the first part of my talk. And the second part of my talk is a 12-point diagnostic system, health assessment system that we utilize, which is based on the yogic principles, so that we have a modern medical diagnosis, but we also have the yoga-based diagnosis. So without saying too much more, I'm going to go straight into my PPT, and I hope you'll be able to see it. Can you see the slides there?
It is starting now.
पहला slide आ गया जी?
नहीं अभी.
एक second. Let's go back. Yeah. Now I think it should be okay.
Yeah. Now we can see.
So integrating yoga therapy within the modern medical system. And before I begin this, I would like to invoke the Guru Parampara that has blessed me. Om Tadparam Paryaya Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guruh Prachodayate Om. Om Shri Gurubhyo Namaha Hari Om. Today I am representing our Sri Balaji Vidyapith, and we are a deemed university accredited with the A grade and have just completed our second cycle and awaiting hopefully an upgrade from NAC. The Center for Yoga Therapy Education and Research was started in 2010, and we focus on cellulogenesis. Cellulogenesis is our focus. So what is this cellulogenesis? The moving from pathogenesis, a focus on disease. Patho means disease, genesis means jananam, to give birth. What are the causative factors of disease is pathogenesis. Moving towards cellulogenesis. Salutare comes from Latin, which means health. And genesis is again jananam, Greek for birth. So rather than focusing on the factors causing disease, we start to focus on the factors enabling health and wellness to manifest. So this is like our Samskrita Bhashya, in which we have a very beautiful two words, Arogya and Swasth. Now, Aroga is the absence of disease. Arogya, Roga as disease, the absence. So it is a pathogenic definition of health, Arogya. But Swasth is a salutogenic definition of health, as Sharma ji was saying yesterday. Samadosha, sama agnischa, samadhatu malakriya, prasanna atma indriya mana, swasth itya bidiyate. That prasanna atma indriya and mana, and everything should be sama, balanced, harmony, and all the waste products should be eliminated efficiently, malakriya. That is swasth. It is a salutogenic aspect of health. So salutogenesis, coming from the word salus, in Latin health, and Greek genesis, source, in combination the sources of health. And this is based on what is called a sense of coherence. And what is this sense of coherence? Is basically that you have a feeling that I can manage whatever is happening within me and things will work out well. That type of a positive approach towards life that gives us good perceived health, mental health, and quality of life. So there are three parts in this. The first part is I can understand my world. The second, I can manage my world. And the third is my world has meaning. So if you break it down to simplistic aspect, we can understand what's happening around us. We feel we can manage what is happening, and we feel that whatever is happening has some meaning in it. This is the traditional basis of Indian culture. Indian culture understood the importance of swadharma. And when you live in tune with your swadharma, all of this will automatically happen. So salutogenesis on one side, pathogenesis on the other. Pathogenesis, what is disease? Oh, how can I avoid the disease? Reactive, it is against pain or loss, and we want survival. But salutogenesis says, what is inducing health? How can I reach my potential? As Swami Vivekananda so beautifully quoted the Vedas when he said, all souls are potentially divine. Aham Brahmasmi is what he brought out there. How do you manifest positive health? How do you live life fully? And this is why, if we look at illness and wellness, we realize that the treatment paradigm is down here, looking only at disability, signs and symptoms. But the wellness paradigm, it goes all the way from this end of the spectrum to the other, giving us a high level of wellness, which is the theme of this workshop. How wellness can manifest through yoga and yoga therapy. So health is a dynamic movement. On one side, disease, on another side, ease. So we are looking normally at pathogenic deterioration. We want to move to salutogenic enhancement of health. So in our systems, initially there were a lot of systems that were called alternative medicine. Now, when we say alternative, uska matlab kya hai? Alternative ka matlab hai either you or me. That is the meaning. So automatically uspe jagda ho jata. Fights will come. Because you, if you are there, I cannot be there. If I am there, you cannot be there. That is alternate. This then moved into complementary. Complementary ka matlab, you and I can work together. So what has happened is from you or me, we are now you and me. You and me are working together. That is complementary. But then even more than that, we need to move towards integration. Integration may, there is no you, there is no me. It is only we. We have become the team. And that is why the WHO is now propagating for the last 5 years TCI medicine, traditional, complementary, and integrative medicine. And this is how WHO set up that committee, of which Sharma ji and I were there, to set benchmarks as part of this focus on traditional, complementary, and integrative medicine for yoga. Now, many years ago, Rudyard Kipling, who lived in India and wrote many books, including the famous Jungle Book, he said, East is East, West is West, and never the twain shall meet. But I would like to tell him, I'm very sorry, Mr. Kipling. I'm very sorry. They have actually met. How have the East and West met? Through yoga. And you can see his famous character, Mowgli. Even Mowgli is now doing yogasanas these days. That is how it has come together. We are finding many of the Eastern healing traditions are coming into healthcare system worldwide, especially the mind-body therapies, because they are focusing on health promotion. What are the intrinsic connections that are there between your brain, your mind, your body, and your behavior? How all of this can come together? Well, yoga is a good answer, because yoga is all about integration. Yujjate anena iti yoga. Everything is coming together. In the UK, the National Health Service, they on the website are now recommending the benefits of yoga, telling us that people with high blood pressure, people who have heart disease, people who have body ache and pain, especially low back pain, and people with depression and stress, yoga can help them. This is not Indian government. This is the National Health Service in the UK. This is the type of acceptance coming. Let's go over to the US of A, in America. Between 2012 and 2017, the percentage of people practicing yoga went up from 9.5 to 14.3. And those practicing meditation of different forms, 4% to 14%. What a jump in just 5 years. This is the type of acceptance happening around the world. And they have found that people practice for health and well-being. This is in the National Center for Complementary and Integrative Health. And on their site, they are telling us back pain is the #1 reason people use complementary health practices. And 22% of these people said their doctor recommended it. Not in India, in the USA. This is the type of acceptance that is growing these days. And the gold standard of yoga, gold standard of any research for that matter, is PubMed publications. And just yesterday I Googled, and 6,592 search results come up in PubMed when I type yoga therapy. And you can see in the graph here, 1948, there was nothing. And since the last 75 years of our Azadi Ka Amrit Mahotsav time, you can see how yoga has also had that amazing growth. And look at this growth, especially in this last few years. Amazing growth of publications that are gold standard research in PubMed. I must mention my dear Guru, Madan Mohanji, who has given me an understanding of yoga research. He, for the past 40 years at Jipmer, attempted to bring together yoga and modern medicine. And thanks to the Moraji Desai National Institute of Yoga, in those days under Department of Ayush, Ministry of Health and Family Welfare, we could have a center in Jipma. And Sir brought out a beautiful publication introducing yoga to medical students, the Jipma experience. And you can see a beautiful site here of medicos practicing yoga under the guidance of Madan Mohan sir. This work is being taken forward in multiple directions, including at our own university. And the work of Madan Mohan ji, the work of Dr. Bijlani sir, my dear Sadbir Khalsa, the amazing contributions of Shirley Tellis, Larry Payne, and Dean Ornish. Dean Ornish, who has shown how even heart disease can be reversed by proper lifestyle. And all of these people here in this image with me at Sitar a few years ago are the medical doctors working with yoga therapy through the International Association of Yoga Therapists. Numerous standard textbooks have come out for yoga therapy, including our own latest book with Lee Majiski, who I had met at Kaivalya Dharma many years ago, and we set up her program, a beautiful program for chronic diseases and cancer survivors. On yoga therapy, a whole person approach to health. You have yoga science in pain care, yoga for grief relief, Dilip Sarkar's yoga therapy, Ayurveda, Western medicine. So many amazing books coming together to give us an understanding of how these two amazing sciences, the traditional and the modern, can work together. Joseph Lepage from Brazil, he has the integrative yoga therapy, and he went around India and made a beautiful video project of yoga therapy in India. Even our Indian people don't know that we have so many centers and such traditions are there. He documented all the traditions and he has put out on his website, which I have given the link below, amazing videos of all the major yoga schools where yoga is practiced as therapy. So coming back to my original question, when you have these two, the tradition on one side, the Rishi Muni, the modern doctor on the other side, how do you bring them together? Well, communication. Communication is vital for integration. So then the question, how to communicate? That is what I'm going to address. Yoga and yoga therapy. In 2019, along with 3 of my colleagues in the USA and Canada, we worked together to create an article, The Language of Yoga Therapy. How can you explain to people what is yoga therapy? And in that, we created this image. There is this huge circle of yoga, and yoga therapy is one small circle inside the circle of yoga. It is not separate. Yoga therapy lies within the larger circle of yoga. So neither is it separate from yoga, nor is it greater than yoga. This is a very important understanding we need to have. And the latest definition in 2020 of yoga therapy by IAYT, it is the professional application of principle and practice of yoga, not just asana therapy. The principles of yoga, the practices of yoga, for what? To promote health and well-being within a therapeutic relationship where you have personalized assessment, which is the tools I'm going to talk about later. You set the goals. What are the goals you want to work towards? Lifestyle management, and the yoga practices are given for individuals or small group. Not 10,000 people at a time. That is not yoga therapy. That is yoga awareness. Like our common yoga protocol, that is yoga awareness. It is not therapy. Therapy means you need to work with the individual or small groups. So where does this all come in? The modern term psycho-neuro-immunology. And during the COVID pandemic, this has been one of the greatest contributions of yoga. Because how you think, how you feel, all that emotional stuff that goes on in your limbic system, that will affect your hypothalamus. That will affect your nervous system, your endocrine system, your immune system. And that same mechanism can be used mindfully to make you healthy once again. So the stress comes in. Of COVID is the best example of pandemic of stress, fear. the nervous system, endocrine system, immune system are affected, and you retard the healing, delay the rehabilitation, and make the person vulnerable to conditions. But then the same mechanism you put in yoga. So stress comes in, you have the red pathway. Yoga comes in, you have the green pathway. And please note, the arrows go in the opposite direction. Stress is going in one direction, yoga goes in the other direction. Enhancing, healing, and facilitating rehabilitation and wellness. And this is why yoga can be understood as a vaccine against stress. If you haven't yet got stressed, yoga is the vaccine. If you are already stressed, yoga is the antidote. Because the stress is perceived. It comes down into your brain, into the nervous system, comes down through all these mechanisms, and you have the fight or flight. The same thing has been told 5,000 years ago. The Yoga Vashishta. Yoga Vashishta is the first recorded counseling session in human history, where sage Vashishta Muni counsels Lord Rama, who was having teenage problem. He didn't know what was going on. He was depressed. Just like the second recorded counseling session, the Bhagavad Gita, where Arjuna was in Vishada. In the first counseling session, Rama didn't understand the purpose of life. He was asking the question, what is life? What is the purpose? So his father, King Dasharatha, calls the Kula Guru, Vashishta Muni, and says, please counsel my son. And through that Yoga Vashishta teachings, Rama understands his Swadharma as an avatar, as a Maryada Purusha on this planet. In that Yoga Vashishta, we understand the concept of Adi and Vyadi. The Adi, where we feel separated from the universe in which we live. And because of that, mental agitations leading to distorted pranic flow in our Pranamaya Kosha. Coming down into the Annamaya Kosha with Ajiranatvam, Matijiranatvam, Kujiranatvam, normally described as digestion. I like to retranslate as hypocellular activity, hypercellular activity, and altered cellular activity. The cellular activity of all the trillions of cells is affected. And that is why the Vyadi is manifesting in the Annamaya Kosha. And this is why when we want to deal with it, we have to go back to the root cause analysis. The great Tamil saint Thiruvalluvar tells us, Noi nadi, noi mudal nadi, adu tanikkum vai nadi vaipachayal. Look for the disease, look for the cause of the disease, find the remedy and apply it to the root cause. Not symptomatic management, root cause analysis and treatment. Once the stress comes in, it comes through 4 phases. The psychic phase, which is in the Vijnanamaya and Manomaya Kosha. You are not feeling good, something is wrong. You are like, it is not, I am not me. That type of feeling, psychic phase. Uske baad, that comes down, psychosomatic phase through Manomaya and Pranamaya. If you still don't do anything about it, it comes into somatic phase, Pranamaya into the Annamaya. And in organic phase, it settles into the Annamaya. Once it is settled into the Annamaya, it has become a permanent disease. When it was still in Vijnanamaya, Manomaya level, you can tackle it by using the yogic methodology, the Yoga Chikitsa methodology. Once it comes into somatic and organic, yoga will become adjuvant therapy along with other therapies. Somebody already has been diagnosed with cancer. Don't think only yoga therapy will help. You will need other therapies, but the yoga therapy will enhance quality of life. Yoga therapy will enhance the immune response of the killer T cells. Yoga therapy will give them the power to fight against that cancer. So it becomes an adjuvant as part of the wholesome management. But initially, when people are very anxious, they're very depressed, and it is still not yet settled down, mild and moderate levels of depression and anxiety, only the pranayama can work itself. You don't need medicines. You can work alone with yoga therapy at that time. So there are times that yoga therapy can be a monotherapy And there are times where it will become adjuvant therapy, collaborating with other systems of medicine, whatever that system may be. One of my mentors, Selvamurthy sir, he retired as DRDO controller. He was a good friend of our former People's President Abdul Kalamji. And he gave a triple formula for yoga and stress. He said, yoga enables and empowers the individual to modify the perception of stress, optimize the response, and efficiently release. So the first part is you have to change the way you perceive it. If I think someone is going to kill me, I'll be stressed. But if I think somebody is going to help me, I will not be stressed. So the same person, me thinking they are an enemy, I get stressed. I think they are a friend, I don't get stressed. How we perceive life will enable the stressor to manifest the stress. You then optimize your response. There is a stress, but you don't have to go and break. You can just bend. That is called adaptive resilience. The tree that bends in the wind, it will stay. The tree that doesn't bend will break. And that is why optimizing our response, we are not becoming just flexible of body, flexible of emotions, and flexible of mind. That is what yoga is enabling. And we release the stress. Why hold on to the stress? Throw it out, say, choo, and throw the stress out so that the stress is not in you. Whenever you have junk in your home, I hope you throw it out. If you keep every day's junk in your home, what will happen? Your home will become a junkyard. If you keep all the junk thoughts in you, if you keep the junk emotions in you, if you keep the junk food in you, what will happen? You will become a junkyard. That is Vyadi. You have to throw it out. Malakriya is the message there. So the same stressor, it comes in. The tension is there. How you face the stress will either make it salutogenesis, going towards positive health, or it will become pathogenesis, breakdown, disease, and death. So the stressor is the same. During the time of the COVID crisis, some people have broken down. Some people have become a better version of themselves. They have used the same stress to become a better human being. My hope is that we as a race, the human race, can utilize the COVID pandemic to become a better version of humanity itself. A version that will respect the planet, respect our Ma, Bhumi Mata, take care of her, respect each other, respect all life forms, because we realize that the same Atma that is there in Sarva Bhuta is there. Madatma, Sarva Bhutatma. We realize that. And we transform. The stressor is the same. The same examination can make you come out with flying colors. The same examination can make you commit suicide because of failure. What is the difference? How you approach that exam, how you approach the stress, how you approach the challenge in life. And that is where yoga enables transformation of the individual. A major life event occurs. Environmental stressor, trauma, abuse, and we perceive the stress. Once we perceive the stress, all the physiological responses are there and disease occurs. But what is the key place where yoga comes in? The key place is this place. I hope you can see the highlight happening there. That
Yes.
perceived stress, that is the place where yoga is changing. Because if you change here, uske baad koi stress response nahi hota. That is the entry point. The perception of stress is the entry point. And that is why Maharishi Patanjali has given us the best therapy for this. It is called Pratipaksha Bhavanam. Krita Karita Anumodita Lobha Krodha Moha Purvaka Mridumadhya Adimatra Dukkha Ajnana Anantapala Iti Pratipaksha Bhavanam. Pratipaksha Bhavanam has to be there. Because what is happening? The vitarkas are coming, the stressors. Vitarka Himsadaya. Krita karita anumodita. We have to understand all of this. We have to understand that the stresses are coming. Apply the Pratipaksha Bhavanam. This is the basis of what today is called Cognitive Behavioral Therapy, CBT. It started with Maharishi Patanjali and Pratipaksha Bhavanam. The moment you change your attitude, you have changed your response. That is why yoga is not about just the asana. Yoga is about self-transformation. Changing your attitude. How do you perceive life? When you perceive the whole world as Vasudhaiva Kudumbakam, there's no Dvaitam. If there's no Dvaitam, there's no Bhayam. Because Brihadaranyaka Upanishad tells us that Bhayam comes from Dvaitam. From that sense, you are different than me. He is Pakistan, I am India, so we will fight. Now, if you say, I am not Indian, he is not Pakistani, we are human beings, there is no fight. See, this is the thing that we have to understand. What is the similarity? What is the commonality in our genes? 7 billion people on this planet. And you know what? Our genome is about 97% the same. Only 3% is difference for 7 billion people. How much is same? 97%. And we'll fight over, that is your religion, that is your nationality, that is your language, that is your lifestyle. You are pro-life, you are anti-life. Kya? Ispe kya hai? Self stress hota. When you start to see commonality, when you can understand Madatma Sarva Bhotatma, where is the stress? And that is where the change in attitude is the key aspect of yoga. And that is why yoga as a methodology to change our perspective. Plato, again a very wise man, long ago says the treatment of the part shouldn't be attempted without treating the entirety. The treatment of the body without treating the mind and soul is a useless waste of time. That is why we had Prasanna, Atma, Indriya, Mana in our Swasth definition. We are finding that in the healthcare professionals, we can start to show that yoga has promotive, preventive, and curative potential. It is a safe, non-pharmacological therapy. It is an effective lifestyle adjuvant to reduce drug dosage and improve quality of life. Conditions like diabetes, hypertension, asthma, irritable bowel syndrome, we are finding that you may be able to prevent and manage. And in so many of these conditions, you may be able to reduce or eliminate the drug dosage and dependence. But what I like to always stress, collaboration. We need to collaborate with other systems. Because when we say, I have all the answers, we will have some problems. I think we need to understand collaboration is the key word. Lifestyle modifications, rehabilitation, coping skill. How do you cope with all the problems in life? And so B.K. Sayangarji so beautifully said, yoga may not be able to always cure, but it can surely help us endure. Looking at healthy diet, relaxation, we can reduce the expenditure of healthcare. Anti-aging, Kaya Kalpa of yoga is there. Psychotherapy, a beautiful place where yoga can come. Women's health, right from the teenage, puberty times, up to the perimenopausal and menopausal times, and then after that, during the geriatric period also, and in research. It has been shown that yoga as a therapy can reverse heart disease, can help people who have respiratory disorders. It's a therapeutic tool in children with special needs, the Divyanga. It is a therapeutic tool. It can have great potential for metabolic syndrome, obesity, and in psychiatry has again great potential. Research has shown that in the past few decades, there's more and more research coming out, and 3 major places that yoga therapy is coming in: mental health, cardiovascular disease, and respiratory disease. So if as a yoga therapist, you want to go out and help people, the first 3 choices that are very useful are mental health, cardiovascular health, and respiratory health. So when we talk about yoga therapy, we can say body, mind, and spirit. And at 3 levels, it is acting. At the body level, restoring function, creating healing. At the mind level, creating healing and reducing suffering. And at the spiritual level, creating community and reducing suffering. Beautiful mechanisms by which yoga as a therapy is working. But the key place is in relaxation. Because relaxation is where you start to heal yourself. The moment the person relaxes, all the intrinsic healing response mechanisms will come into play. And this is why relaxation is the key to healing. If you are stressed, you cannot heal. You need to be relaxed. So you have to work on the relaxation response. The relaxation response will then induce the healing response. And to me, this is yoga's greatest contribution to modern healthcare, because as a modern medical trained doctor, we don't have non-drug therapies to relax. And the moment you give a medicine, you are going to be bound by side effects of the medicine. So if we can give a non-pharmacological methodology of relaxing, we are going to facilitate healing. This is where our culture has always given the 5-fold aspect. Achar, Vichar, Ahar, Vihar, and Vyavahar. Many people forget the Vyavahar part. Healthy relationships are part of maintaining and sustaining health. Healthy exercise, healthy thought patterns, healthy dietary patterns, healthy relaxation and recuperation, and healthy relationships. Now, coming back to the World Health Organization, they have a definition of health. Health is a dynamic state of complete physical well-being, mental well-being, social well-being, and spiritual well-being. Not merely the absence of disease. Now, where does that come in our Ashtanga Yoga of Maharishi Patanjali? Yama Niyama, they are working on the domain of social health. When you practice and live Yama Niyama, the social health domain you are enhancing. Through pranayama and asana, we are working on physical health domain. Pratyahara and dharana, the mental health domain, and dhyana samadhi for spiritual health domain. The same 4 domains of World Health Organization, already Maharishi Patanjali's Ashtanga Yoga is having the tools to work on these domains. Because healing is multifactorial, lifestyle, attitude, relaxation, and breathing. All of these have to come together if you are to heal. Now, this is very good. Conceptually, it is very good. How do I put it into practice? Dr. Ananda, very nice. But how do we put it into practice? Well, here's where I share some of our experience over the last 11 years at the site of Sri Balaji Vidyapith, where we are educating future yoga therapists. We are helping patients recover from illness. And we are also scientifically researching the hows and whys of yoga. Our clinical services, about 80,000 participants have benefited. You can see the beautiful smile on her face as she's coming into that yoga therapy session. Working with children with special needs, Divyanga. Working with patients in the psychiatry ward. We go into the ward and our instructors give the practices. Here in palliative, you can see one of our graduates, how the giving company in the end life situation, giving them an opportunity to be listened to and loved. Again, the work with the special children, the Divyanga, helping them not only come to normal, but go beyond that into a supernormal state of well-being. The work in the community, outreach, patient care, and cross-cultural, cross-religion. I would like to share the story of this gentleman here. He had a cancer and they removed one lung. Ek lung ko pura nikal diya surgery mein. Then they sent to yoga therapy. Maine pucha, what do you want from yoga therapy? Yoga therapy say, what are you expecting? He said, I know I'm going to have, death soon. But he said, what is my problem? I cannot do my prayer to pray to my God. That was his problem. He said, I know about my cancer. I know the surgery. I know I'm going to die. But I am not able to pray my God. Now he came for some sessions at Saita. And after that, you can see him thanking us. He said, now every day I can do my namas. I can pray to my God. And he said, now I am ready to face death. And I am at peace. That is a very important aspect of yoga therapy. Not that, did you stop him from dying? No, have you given him a new perspective towards the end life state? Similarly, we are doing the research on different conditions. And the main finding I wanted to share is, when you add yoga therapy to the modern medical therapies, we can halt the disease progression. Because if somebody has diabetes and you are having medicine, you are taking medicine, but the disease is still worsening. It is becoming worse and worse and worse. You have Parkinson's, you give the dopamine, but still it becomes worse and worse. Any disease keeps deteriorating. But if you add the yoga component to modern medical protocol, we are able to stop the disease progression. So then the medicine can work better. This is the most important aspect that I wanted to suggest here. And we have done work in essential hypertension, in the psychiatric ward, chronic kidney disease. We talked about psychic, psychosomatic, somatic, and organic. Kidney disease is where the organic stage, even there yoga can have some effect. The stress of not sleeping the whole night and being on duty, how can you reduce it? By giving them relaxation. People who have lung disorders, how can you help them? And the pregnant mother, when the mother is pregnant, how the chanting of the Pranava, that Pranava Japa can help the mother and help the baby. Similarly, people going in for angiography, they have a heart issue, they are going in for angiography. There's a lot of anxiety before the operation. By giving yoga and music therapy, you can reduce the anxiety. You can help children who have autism. You can help people whose lungs are affected by diabetes. People who have chronic rhinosinusitis, because they always say, once a sinus, always a sinus, because you keep on getting treated. But when you add Pranava Pranayama to it, unka improvement itna jada hota. So you are giving the modern medical management, but along with that yoga, adjuvant, collaboration, and the patient is benefiting. The patient outcome, the clinical outcome is better. And similarly, in toothbrushing, in children who have autism, they are not able to keep oral hygiene. When you teach them yoga, they can learn their dental hygiene better. You're enhancing the learning process. And in people who have depression, the role of yoga as adjuvant. Not only is depression brought down, but many of them also have coexistent anxiety that is also managed. We have worked on people who have addiction problem, alcohol addiction, a very big issue in our country, in especially rural areas. The alcohol addiction and how you can reduce the craving. If people have diabetes, the kidneys are at risk. How can you help them? The women who are in an hospice, the elderly women, how can you improve the neurological function in them and as well as in our children with autism? And one of the recent studies, yogic relaxation on biopsychosocial parameters before endodontic therapy. You are going for a root canal treatment, lot of stress is there. Before that, you can give relaxation and breathing, and you reduce the stress during the procedure, the outcome of the procedure will be better. So pain is also less, the outcome is better. And at Saita, we have been one of the first places in the world where yoga therapy and dentistry are working together. So not only the medical, we have worked with nursing, and we are working with allied health sciences, all the allied health sciences, and taking it forward. So here you can see students in our university, the medical students, during the session, they can have a yoga break. They can learn a bit about the yoga practices. The nursing students who come to Saita, And during our clinical meetings, our doctors are getting that beautiful awareness of yoga and yoga therapy. The nursing staff come to Saita and they get trained. You can see them doing Shanmukhi Mudra and Pranava Pranayama to help reduce the stress so that they can give better patient care facilities. And all the students are getting the practices, senior citizens, special children. And here, the people who are having gender issues, the transgender community, we are supporting them. Lot of stress in their life and how yoga can help them. And this is why our dear Dilip Sarkarji, he has complimented saying this is 21st century medicine, where along with modern medicine, the yoga therapy has become part and parcel of the healthcare delivery system in our university. Before I end this part of my presentation, I want to make a statement here. For too long, we human beings have focused on our ego. We are the human being. We are the top of everything. We own the planet. We can do whatever we want. And we have thought of all other living beings to be below us. I think this is the time we need to shift from that ego-based to an ecology, eco-based, where we understand we are part of the whole environment and we have a responsibility, hamara zamindari hai, to take care of this planet. And this is the message we should bring through yoga, where the environmental aspects are also addressed. We think, oh, go and sit in the yoga class, sit on a yoga mat, do Surya Namaskar, now you're yogi. No. Have you transformed yourself? Has your thinking process changed? Have you started to become a better person? Have you started to have a greater positive influence on the society where you live? Are you changing the world by your example? Then yoga has come into your life. Just doing Surya Namaskar or Kapalbhati or Anulom Vilom, it will not make you a yogi until and unless you bring the change from within. That is the inner parinama that has to occur within us. Because without that parinama, gunavritti will not go back. Prati prasava will not happen of gunavritti unless parinama occurs. There has to be that transformation of the individual. So this is the first part of my presentation. And I wanted to share this message of yoga therapy and how it is coming into a modern healthcare system thanks to the support of our management and administrators of this university. I think this is a very good way to go forward, because recently we had some controversies about yoga and modern medicine. And people asked me, they said, Dr. Ananda, you are a medical doctor, you're also yogi. They call me a yogi, I'm not a yogi. I'm a yogi in the making, aspiring yogi. Kyunki the state of yoga for me is still very high. I said, yes, I am a proud member of Indian Medical Association, but I'm also a proud member of Indian Yoga Association. And I believe they don't have to fight. I believe they can work together. Kyunki hamara attitude hai, we have so much to offer by coming together. So this is the first part of my presentation. And when the patient is coming to us in our center, we are not only looking at the medical diagnosis. Medical diagnosis hai diabetes. Medical diagnosis hai hypertension, cancer, asthma, depression, anxiety. That is a medical diagnosis. The question I ask my students and our therapists, the question is, what is the yoga diagnosis? We need to know the medical diagnosis to communicate with the medical doctor. We should know the medical pathophysiology to understand what is their diagnosis, what is their treatment, what they are doing. But we should not be giving yoga practices for somebody else's diagnosis. That will become yogopathy and not yoga chikitsa. Yoga chikitsa ka matlab hai ek wholesome, holistic system hai. But it doesn't mean you say, oh, I will only follow this and modern medicine is nonsense. No, that is a wrong attitude. The same people who say modern medicine is a nonsense, when their family member has a heart attack, which hospital do they go to? So when you have a heart attack, you want modern medicine. Other time you say modern medicine, down. See, we have to be very careful here. We have to understand we need to respect each other. When I respect you, automatically you respect me. If I disrespect you, how can I expect you to respect me? And this is the type of approach we need to take. So along with the modern medical diagnosis, what is the yogic perspective? What is our perspective of the individual's health status? And so we have developed something called Dwadasha Roga Lakshana Anukrama. So it is a methodology, an anukrama of Roga Lakshana, understanding the disease in 12 point, Dwadasha. This was initially given by my father, Swami Geetananda Giri, more than 50 years ago. But in that time, it was in our ashram, it was in his own classes. Today, we have brought it into a modern medical institution where we have a case sheet. We have got a copyright on that. A case sheet in which this is noted down. So we have the modern medical diagnosis on the case sheet. We have the yogic assessment also on the case sheet. That is the type of coming together we want so that we are understanding both. If I look from this eye, I can only see something. If I look from this eye, I can see something. When I look through both eyes, I see the wholesome picture. So with this introduction, I'm going to go into presenting to you this slide. 1 second. Just open up the slide. Yes. Okay. I hope you can see a screen there.
Yes, yes.
So I am presenting this as yogic diagnostic tools. Now the question comes, isn't diagnosis a medical scope of practice? Yes. But what we are saying, I am not making a medical diagnosis, I'm making a yogic diagnosis. So this we have to be very clear. That we are not saying you are making a medical diagnosis as a yoga therapist. You are making a yogic assessment and a diagnosis. So it is a patient evaluation. What is called Dwadasha Roga Lakshanam Anukrama. A concept by Puja Swamiji Geetananda Giri. And this presentation has been prepared for me by one of my star students of CITER, Shwetika Akol, who's in Delhi, and had put it together so beautifully as said, this is a good way to express it. So what is yoga and yoga therapy? Yoga, it is the process and state of integration. So it is both the process towards samadhi and it is samadhi also. So it is the process and the state of integration, oneness, and yoga therapy is the tools to attain integration. So yoga is the process, the state, yoga therapy as the tools. And the primary cause, as we said, Dvaitam, duality, dichotomy. I am different than you. This universe and me have nothing in common. My mind and body have nothing in common. Automatically, what has happened? Duality has occurred. With the duality, what will happen? Automatically, disease occurs. And disease as moving away from sukha sthanam. You're moving from sukham to dukkham. And that is why through asana, we are regaining the sthirata and the sukhata that we had lost. And the dvandvas, which are the duality, we are transcending as dvandva anabhigata. We are transcending the dualities. Yoga also says disease is because of the three doshas and their imbalance, the prana and its imbalance, and the concept from Yoga Vashishta, psychosomatic and non-psychosomatic disorders. The Adija Vyadhi, Anadija Vyadhi, and of the Adija, it is mentioned Samanya diseases which you give the therapy. But Sara Adija Vyadhi, you are coming back again and again and again and again. Punarabi Jananam, Punarabi Maranam. You are into that constant cycle. Jananam Maranam, Jananam Maranam, Jananam Maranam, Jananam Maranam. You have to come out of that because that is the disease. And what is the way to come out of it? Atma Jnana. What a beautiful concept in our tradition. Aneka janma samprapta karma bandha vidahine Atma Jnana pradhanena tasmai Shri Gurave Namaha. The Guru who gives us that ability for Atma Jnana, because the moment Atma Jnana is there, Jananam Maranam has stopped, you have gone beyond. The Dvandvas of Jananam Maranam, you have gone Dvandva Anabhigata. If you consider Jananam and Maranam as Dvandva, you have gone beyond that through Atma Jnana. So this concept, I have already discussed in the previous presentation, where the Adi coming down and creating the Vyadi. So we have the therapy models, Yoga Vashishta model, where we can use the Panchakosha to understand how at Vijnanamaya, Anandamaya, there is a split leading to Manomaya agitation, Pranamaya agitation, Annamaya agitation. The second model is Chatur Vyuha model, Heya Hetu Hana Upaya, based on the Yoga Sutras of Maharishi Patanjali himself. You have the Klesha model, which is again one of the greatest contributions of Maharishi Patanjali, is the concept of the Kleshas. Because the Kleshas are leading to the Karmashaya. Klesha Moola Karmashaya. Drishta Adrishta Janma Vedaniyaha. And that is why the Kleshas have to be eradicated by the process of Tapaswadhyaya Ishvara Pranidhanani Kriya Yoga. Because Samadhi Bhavanartha Klesha Tanukaranarthascha. That is the process, the Klesha model of Avidya, Asmita, Raga, Dvesha, Abhiniveshaha, Kleshaha, and those Kleshas having to be eradicated. The Pranavayu model, where you understand that the diseases are a manifestation of imbalance of the different prana. It could be the prana in the Hridaya, Hridi Prano. It could be the Gude Apana. It could be Samana Nabi Mandale. It could be Udana Kanta Deshasto or Vyana Sarva Shariragaha. All of these pranas, when they go into imbalance, they create disease. So part of our diagnosis is what is the alteration of the prana? What is the klesha state? What is the prana state? And then you can also go into what is the state of the different chakras. Be it Mooladhara, Swadhisthana, Manipuraka, Anahata, Vishuddha, Ajna or Sahasrara. In our tradition, we have Dvadasha chakras. We have 6 Anda chakras, 6 Pinda chakras, and how their alterations, how their malfunction. The chakra is okay. Our connection to chakra is malfunctioning. It is like you are there, I am here. Kabhi kabhi to internet, Akasha Devaya, they are causing problem. But you are there, I am here. But suddenly I said, I have lost you. No, I have not lost you. Now, you are there, I am here, but the connection is lost. Kabhi kabhi kya hota, that connection to the chakras is lost. And then the Kaivalyadama model suggested by Swami Kuvalayananda ji and Vinekar in the book. Cultivation of correct psychological attitude. You have to change here. You remember stress? Stress ka most important entry point is perception of stress. And that is why Maharishi Patanjali, master psychologist, master psychotherapist, already unhone bol diya. Maitri karuna mudito pekshanam sukha dukkha punya punya vishayanam bhavanatah chitta prasadanam. You want chitta prasadanam, bring maitri towards sukha, karuna towards dukkha, and have mudita towards punya, and have upekshanam towards the apunya. Itna bol diya Maharishi Patanjali. And what is happening with us? We are doing upekshanam towards punya. We do mudita for the apunya. That is the problem today. We have got it all messed up. So we have to recondition our attitude We have to recondition the neuromuscular, neuroglandular system. That is psychoneuroimmunology. When Swami Kulainanda wrote that book, Yogic Therapy, that concept of psychoneuroimmunology wasn't there. But now we can say that is what he is talking about. Psychoneuroimmunology, usko recondition karna chahiye by using the different practices, be it the Shuddhi Kriyas, be it the Asana, Pranayama or whatever. Yama Niyama are very important in psychological reconditioning. In physiological reconditioning, all these practices and the appropriate diet. Now, what is the patya and the apatya aspect of diet has to be addressed. And encouraging the malakriya through the shuddhi kriyas. These are different models. There are different interventions you can understand at the pancha kosha level, annamaya kosha, different loosening practices, different movements, asana and dietary modification at the annamaya kosha. Pranamaya kosha level mein shatkarmas, pranayama, prana anusandana, breath awareness, breath movement coordination and balancing the pranas. Manomaya level, trataka and dharana, dhyana and japa. At Vijnanamaya level, Swadhyaya, Satsanga and Anubhava. And Anandamaya Kosha level, implementing the principles of Karma Yoga. The action in relaxation. In Karma, you should see the Akarmani. In Akarma, you should see the Karma. That is the balanced state that Bhagavad Gita is talking about. And understanding through Bhakti Yoga, Karma Yoga, that bigger picture. As I said, 97% of our genome is the same. We should start to understand that oneness. Vasudhaiva Kudumbakam. In Tamil, we say, Yadum Ure Yavarum Kele. Another way to look at it is physical therapies. The asana, kriya, mudra, and bandha could be understood as a physical therapy. When you talk to the modern healthcare, this is how you can express it. Emotional therapy, swadhyaya, pranayama, pratyahara, dharana, dhyana, bhajans, the concept of vairagya, and chitta prasadanam, and the maitri karuna can be brought in there. Mental therapies, where the relaxation, visualization, prataka and all come in. Spiritual therapies, swadhyaya, satsanga, bhajans and yogic counseling. But very important, preventive therapies. Heyam dukkam anagatam. Preventive therapy, start early in childhood. Prevent the accidents by body awareness, kinesthetic awareness, awareness of what is happening in your body, where you are. Improve the immunity, as in today, the pandemic time. And if you learn it as a child, when you need that technique later on, you can easily relearn and practice it. Rehabilitation, after surgery, after accidents, helping person to come back to normal, and pain relief therapies by increasing pain tolerance and improving quality of life. These are some of the places yoga comes in. Now here I present the yogic 12-point system of diagnosis, health, evaluation. This is based on my father's teachings, and it takes into consideration the 3 gunas. It takes into consideration the 3 dosha, the 3 vasana, the prana, abhyasa, jiva karma, which is our lifestyle, chetana, the quality of thoughts, vacha, how do we speak, ahara, our diet and food habits, viparita buddhi, the destructive habits that are totally against common sense, jiva vrittis, the body rates, biorhythms that are there, and sankalpa, what are the higher ideals of the individual. And so for this, we have to understand that what is the need for these tools. Yoga therapy isn't a symptomatic treatment. So you say, for diabetes, what are 25 asana? For hypertension, 12 asana. No. You have to look at the individual, not this idea that you just give one common standardized protocol. That will not work here. And so we need the diagnostic tools of yoga. We also need to help the patient understand and accept the problem, the cause of the problem. Without acceptance, change cannot occur. And so it is very important to use these tools also as an educative tool. And you can then have a baseline. Before you start the yoga chikitsa, what was the assessment from a yogic perspective? How does it change over the course of your treatment? And if you need to change your treatment in between, and through this, we try to understand the patient in a wholesome manner, not just their stomach pain. They have stomach pain, but the stomach pain is only a symptom of something much larger. What is the larger picture that we want to understand? And for that, this tool, Roga Lakshana Anukrama, we have 4 basic categories: Darshanam, Sparshanam, Prashnam, and Nadi Pariksha. These are the 4 basic components where how you observe the individual, then palpation and touching if required with permission. The Prashnam, where you have a lot of inquiry. This is a very important component because through this questioning, you try to understand where the problem really is. And then you examine the pariksha, the examination, if required, to understand the energy flows in the individual. So here in the darshanam, some of the components, you can look at the weight, height, the BMI, how fast are they breathing, what type of body type, are they endomorphic, ectomorphic, what is the mood when the person comes into your consultation chamber, what is the mood like, their spine, are there any altered curvatures in the spine, how do they move, what is the walking, are there any tremors, angame jayatva, are there any tremors that are found, and any other aspects like any abnormal smell, what is the gaze like, what is the skin like. You are observing the person in a holistic manner, multiple aspects. The second part is the sparshanam part. What is the person's body temperature? What is the muscle tone? Is the tone normal? Is it low? Is it hypertonic? Are there any signs of anemia? Any nutritional deficiencies? For example, you may have to look at the lower conjunctiva to see anemia. You may have to look at and you may have to press and look at the capillary circulation. Hydration, ask them to put out the tongue. See whether the tongue is dry or not. Is the mouth dry or is it hydrated? Joint mobility, you may have to help them move the joint to know how much they can move. And then different lumps. Are there any lumps, any place when you're palpating? Is it hard? Is it soft? Is it moving? And any tenderness. When you touch, are there any parts where there is excessive tenderness? Because that means there is an underlying problem. So we had darshanam, sparshanam. In the prashnam, what is the main complaint? What is the major complaint for which they have come? How long is it there? How severe is it there? Does it affect them in different ways? And then what are the minor complaints, the duration and severity? You need to also ask about appetite and food. You have to ask about sleep. You have to ask about the bowel and bladder. Do they have a normal bowel movement and bladder movement? Or is it excessive? You may ask about medical history that they have here, any medications they are having, family history of parents, grandparents, etc. All of this can come into the prashnam. This is only a basic template. Depending on the individual, different directions you may want to go. And then the Nadi Pariksha, where you want to understand the pulse rate. You want to understand the type of pulse. You want to understand peripheral pulses, different parts of the body. You want to understand the blood pressure. You want to then auscultate. You may use a stethoscope to hear the sounds of the heart, the sounds of the lungs, so that you can understand what is happening inside them in a much deeper way. If you have special training, if you have the skill to understand Vata, Pitta, Kapha based on Nadi Pariksha, you can add that. But that is something which you have to learn individually. And this is not something that someone can teach in crash courses. So here we are not teaching that component. Other traditions give importance to that, especially the Siddha, the Ayurveda traditions. They bring a lot of importance on the Nadi Pariksha as understanding the Vata, Pitta, Kapha levels. Now here we then go into the characteristics of these 12 tools. And in this, the first one is the Triguna. So that individual who has come to you, what is their Prakriti aspect from the mental aspect? Is it Satvika? Is it Rajasika or Tamasika? And there are 9 components. You could have Tamasika Tamas, Rajasika Tamas, Satvika Tamas. Tamasika Rajas, Rajasika Rajas, Satvika Rajas. Tamasika Sattva, Rajasika Sattva, and Satvika Sattva. The Satvika Sattva is that Sattva between Sattva Purushayor Shuddhi Samye. That is Satvika Sattva. But even in Sattva, there is a Tamasika Sattva also. What is the type of Guna? Then what is the type of Prakriti at the level of Vata, Pitta, Kapha? Are they Vata predominant, Pitta predominant, Kapha predominant? Vata and Pitta, Pitta and Kapha, Vata and Kapha, or a combination of all 3. Then we go on to the Vasana. What is the hang-up? Is it Loka Vasana? Many people, they don't even want to come and talk to you. I am director, I am big professor, I am having 25 company. Lot of Loka Vasana. Unko pehle, you have to put them down on the yoga mat and have them crawl around and go bow, 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 bow. Uska ego ko kam karna chahiye. Loka Vasana itna hai. Due to Loka Vasana, all the stresses come. I am this big person. You also eat, you also go to the toilet. Everybody eats, everybody goes to toilet. It doesn't matter whether you are president of the country or you are some chaprasi. Then what is so special? Loka Vasana. Dusra hai Deha Vasana. My nose is so beautiful. I am the most beautiful. I am the most handsome. And the opposite. I am no good. I don't like my body. I don't like my skin. I don't like my hand. It's a lot of Deha Vasana. See, if you don't deal with that Vasana, you will never help them come out of the disease. Because that Vasana is leading to the Samskara. Vasana and Samskaras are leading to the Karma, to the Klesha. So you have to address it. And then Jnana Vasana. This is most dangerous. Humko sab pata hai. What new you will tell me? I say, look, they come for consultation. Bolte, Doctor ji, someone told to come to you. I know all yoga. I know all yoga. I say, wow, you know all yoga. I don't know any yoga. Itna to that Jnana Vasana hai. बहुत हिंदी में बोलते पढ़ा लिखा अनपढ़ है ऐसा बहुत लोग है ज्ञान वासना है इसके वजह से the disease is coming. You have to deal with it. படிச்ச முண்டான்னு சொல்லிட்டு தமிழ்ல சொல்லுவோம். Then the prana. You have to look at the prana, apana, dhyana, samana, udana. You have to look at Naga, Kurma, Krikara, Devadatta, Dhananjaya, the manifestations. Is there any alteration? And Akasha and Chitra Pranavayu, which are the psychomental energies also. You have to look at the Abhyasa, the individual, what effort can they do? Because you want to give them 10 days of yoga therapy, but they will not do it. Then no use. So what is the level of Abhyasa? What is their yatna, the effort? Can they do it over Dirgha Kala for a long time? Can they do it with Satkara? Can they do it without interruption? Nayantarya. Can you give them that Dhrida Bhumi? Can there be a Vritti, Chitta Vritti, Nirodha type of aspect? And can they start to focus on the practice and have a sense of Vairagya? Can they do it? Or how can you help them do it? Because you giving the yoga therapy protocol will not help anybody unless they do that protocol. And that is why you have to evaluate this. Otherwise, all your time will be wasted. Jiva Karma. What is your daily routine in the lifestyle? What is your Yama Niyama? What is your Dinacharya? What is your Ratricharya, Ritucharya? All of these come into the aspect here. Then the Chetana. What type of thoughts do they have? Is it positive, negative, neutral? Are they self-centered and disturbed? What is the speech, Vacha? What is the expression? Is it clear? Is it consistent? Is it refined? Or is it like, I have the scholar doctor? Or is it, doctor, I don't know what to do, Alice. You have to evaluate that. You have to evaluate where is this energy going so that you can balance. For some people, you have to give Brahmari as for some you have to give as because somebody who is, doctor, I don't know what to do, you have to give Somebody who's, "Doctor, I don't know what to do." You have to give, उसको balance करना चाहिए, क्योंकि समा होना चाहिए. Visama will never be healthy. It has to be sama. And that is why we had to bring it into that. Otherwise, what happens is like the Agni. You will have Vishama Agni and all will start happening. Same thing here. Then, what is the food? What type of food? What type of guna of the food? Can they maintain mitahara? What is the quantity, regularity, and the ahara for the panchakosha and the respective disease? The patya, apatya aspect. Do they have viparita buddhi, which are actions that are contrary to health? What are the jiva vrittis, the biorhythms, the nasal cycle? What swara is happening more? What is the heart rate, the blood pressure? What about the menstrual cycle, bowel and bladder? And last but not least, sankalpa. Are they wanting to get better or do they not want to get better? Kabhi bahut log ko kya hai? Disease has become an excuse not to do anything. They will not do. They will stay at home doing nothing because it's an excuse now. So then it is going to be very difficult. You have to create a desire to get better. My father used to say, are you sick to get better or are you sick to become sicker? Are you sick to become better or are you sick to become sicker? Because if somebody is sick to become sicker, it's going to be very difficult for you. But if somebody wants to get better, बहुत लोग हैं, क्योंकि हम तो सोचते that everybody wants to get well. बहुत लोग don't want to get well because if they get well, they'll have to start going to work. If they get well, they'll have to take responsibility. So it becomes a good excuse. And that is why the sankalpa of the individual has to be taken into consideration here. And that is why when we apply this, what are some practical problems? Because we apply it with all our patients here. What are the practical problems? The length of the questionnaire for a beginner. इसको बहुत time consuming है. बहुत time consuming है. And until you become expert. Once you are expert, 10-15 minute में खत्म हो जाता है. But otherwise, 1 घंटा, 1.5 घंटा तो लगता है इसको पूरा करने के लिए, एक patient के लिए. You have to train the therapist in this concept. How to understand dosha, how to understand guna, how to understand vacha. Usko training karna, otherwise becomes very difficult. And then the therapist should have interest. Jaldi khatam karke ghar jana, cricket match dekhne ke liye. Aise log ko, then there won't be time. What is the interest that the person takes, the therapist takes? And then you have to divide the question, not that all will happen in the first session. एक basic assessment है, उसके बाद 2-3 sessions है. In those sessions, you start going into more detail, you add on to it, and that way you have to take it. You have to have some knowledge and you have to have good communication skill, because if you don't have the skill to take blood pressure, you're not going to be able to take it. So you have to develop those skills. You have to have the skill to develop an understanding of the nadi, of the pulse. You have to understand the different type of vata pulse, the pitta pulse, if you're going to go into that, or the kapha pulse. And again, you have to schedule repeat assessment to see how they are improving or not improving and what can be done. And then you have to assess the progress and results at end of therapy. And you have to maintain these records, document karna chahiye, timely document karna chahiye. So these are some practical issues. And most important, patient detail secrecy, confidentiality of the patient has to be maintained. So this is a very important ethical aspect when you work in a hospital setup. My beloved father, Swami Geetananda Giri, made a beautiful statement that today is so true. Health and happiness are your birthright. You ask people, what are you looking for? They say health and happiness. He said, health and happiness is your birthright. Born human, you should have health and have happiness. But what happens? We forget that. We forsake our golden culture for the plastic playthings of the modern world. And he gives a very beautiful message. Learn and live yoga. Yoga is not something you do. You have to become yoga. Yoga has to become you. 24 hours to sadhana hona chahiye. Not just mat ke upar 20 minute ka yoga sadhana. Yoga sadhana to 24 hours hai. Pura life hai. Hamara jeevan hai. And that is why it has to be yoga jeevana. Has to be that type of life. Learn and live yoga, for then you will know true health and happiness. Beautiful statement given by him. And a statement that I always like to give people is the highest attitude is gratitude. Because if gratitude is there in your heart, you will automatically be pulled into seva. Seva bhavana will only come from gratitude. Kritagnyata is the word for gratitude, kritagnya. And to have that gratitude, it then develops seva. Because we are here to serve humanity. We are here to serve the divine. And through that process, we become divine itself. That is the message I wanted to share with you today. A message about our work here in the hospital, and a message about the fact that such a yogic diagnostic assessment tool exists and is being used actively by us at our center here. Dhanyabad ji for this opportunity, and I'm open for any questions that may come.
Thank you very much, Dr. Anand, for the wonderful presentation. Now I request all the participants to ask the questions if they have any question. They may put their question. Page and MG can transport the question to this chat.
Yes, sir. Yes, sir.
That is why I used to say, particularly, Dr. Anand is taking care of the pure and pristine aspect of yoga and its yoga therapy. Thank you for the wonderful session. Sometimes the parents of autistic child come to us to start yoga therapy from childhood. What should be our approach to them as therapists?
I just muted it so that that there's no echo.
Yeah.
We have done a lot of work with children with autism spectrum disorder. And currently, one of our PhD candidates is working with autism children. Another PhD candidate is working with parents of autistic children. So we are looking at the improvement in the child and improvement in the stress levels of the caregiver. And what we are finding is that you have to build a relationship. With children with autism spectrum, the most important aspect is building a relationship, because they have difficulty in relating to other individuals. Normally what is happening is that we go into a session and we think, okay, immediately I can tell they will do. You have to have a lot of patience. So as a yoga therapist, I think the first quality required here is patience, that initially they may not respond to you. My deputy director at CITER, Dr. Meena Ramanathan, has worked for many years with the children with special needs, the Divyanga Yoga, which we have created a separate module best practice at our center. And she used to always say that children with autism spectrum, even when the other children would join into the class, they won't immediately join. So they will stay away. But then what you need to do is you need to just go forward. You need to keep on going forward and taking it forward. And then one day, suddenly, on their own, they will join in. So what we have to work on here is not giving up too soon. I think that is the first thing. Don't give up too soon. It takes time. Keep making your effort. And then the most important is let them know that you have profound interest. You have real interest in them as a human being. When you have that heart-to-heart connection, automatically then they will start opening up, and then the practices. It's not about which yoga practice. It's not the technique. It is the relationship building, and then all the techniques will help the individual. There is a question coming about chronic diseases. How do you motivate them? Well, I think we human beings are so lazy. Even when we get the benefit, we don't continue the practice. So I think constant communication with the individual, constant opportunities for them to continue their practices. If you give them 5 classes and you say that's all, they will not continue. But you say, okay, 5 classes you have done. Now we have regular classes going on in the morning. If you're interested, you can come for that. You give them different opportunities to suit their life convenience. And then you can motivate, because otherwise it's very difficult. You know, what happens is this tamasika guna, lethargy and dull mood, is a very strong issue, which is why whenever we work with people, we give them practices to break through their tamas. The loosening practices, we call them jatis. For example, you know, shaking the hands like this type of shaking the whole body like this, catching hold of the stress and throwing it out. In the morning, you do this. Or we do practices like what we call hakara, making the sound of ha, 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 ha. When you do this, what you're doing, that Nabi, the navel center, Manipuraka, it is activated, and that energy will break through the tamas. So we need to give them a few of these type of practices. If you say every day you have to do Dhanurasana for 10 minutes, they will give up after a few days. So we have to find different ways to keep them engaged and motivate them. There's a difference about the 3% genomic difference. That 3% is what makes us different. See, 97 is common. So 3% is where all the differences come in. Be it somebody in South Africa or somebody in Europe or somebody in Australia or somebody in Canada. Those differences, all those differences of skin color, height, weight, all of that is only in 3%. 97% is common. So that is why I say we need to focus on the commonality. Research on infertility yoga. We don't have a book, but we have a lot of experience with people who were not able to get pregnant. And what we find is that the regular practice, focusing especially on the pranavayu, the pranavayu of apana. Apana vayu is the vayu that is very important as part of the reproductive process. And similarly, that apana vayu is related to your Mooladhara and Swadhisthana chakras. So practices that work on Mooladhara, Swadhisthana, practices that work on apana vayu, and helping the person relax. Because in order for fertility to occur, the person should be relaxed. When they are stressed, all the fertility will go down. So stress management is an important component to deal with infertility, but we should also make sure that the infertility doesn't have a, you should have a full investigation, because there may be a structural block. There may be a problem in the ovary. There may be a problem in, the fallopian tube. So then all your work with all the pranavayu and all the chakra will not help, because the block is there. So they may need to have that block unblocked. These type of aspects have to be taken into consideration. Children with epilepsy. The first thing is, don't teach them Kapalabhati. That is the first thing I want to tell you, because today everybody thinks Kapalabhati is there for everybody. No, it is not there for everybody. People who have a hyper-reactive nervous system, you should not activate it further, and that is what Kapalabhati does. They should be doing more of Anulom Vilom, Brahmari. Brahmari is the best practice for epilepsy. Because when you do the Brahmari, you are calming down all the nervous system. The nervous system calms down. In epilepsy, the nervous system is hyperactive. So calming down is very important. Relaxation is important. Slow, deep breathing is important for such children. People who approach yoga for therapy, they come after they go to many, they leave yoga behind. I think what you mean is that they come to the therapy and then they don't do it. I think that is the question I think they mean. What is important here is that you can only offer the therapy, you can give them the therapy, but as I said earlier, they have to do it. You can give them the vada pav, but they have to eat it. You cannot eat vada pav for them. So this is one of the big issues with yoga as a therapy, that they have to do something. And people are lazy. We had a person who had hypothyroid. And through the yoga, she was able to come to normal thyroid. She taught it to her friends. And the friends, after 2 classes, they said, it is easier to take 1 tablet of thyroid medicine. Why I should do all this yoga? So we have that laziness. We are working against the laziness. So we have to be proactive. How do we change the perception of stress? See, if you want to change the perception of stress, you have to take a step back. Because as long as, if I put my hand right here, I cannot see any of you because I am too close to the hand. When you are so close to the hand, you cannot see anything. But if I move my hand back, now my hand has moved back, I can see you. So what we need to do is we need to develop a capacity to take a step back. This is why Bharatri Hari in the Vairagya Shatakam, he tells us, Vairagya meva abhayam. Without Vairagya, there will be Bhaya. It doesn't matter, you have Rupa, you have Jnana, you have Bala, you will have Bhaya. Everything will have Bhaya. The only thing where there's no Bhaya is Vairagya. Vairagya ka matlab kya hai? Take a step back. Because when I am like this, the problem is big. You move back, problem becomes small. But we are always like this. This is where we are. So the problem looks very big. Come back. Problem to chota hai. Hum to bada hai. So what we have to understand this conceptually. And when we have the problem, we have to take some deep breathing and take a step back. क्योंकि सब human beings का life में stress है. Everybody has stress. Everybody has stress. Nobody is there without stress. Nobody is there without problem. That is the first thing we should know. Otherwise, we think only I have the problem. Everybody has problem of different type. And based on samskara, vasana, all that issues, it is there. What we need to do is, instead of focusing on problem, we should focus on solution. This is where we have to look. This is my problem, my problem, my problem, my problem. No, okay, fine. Problem hai. Problem to hai. Deny mat karo, accept karo. Problem hai. Lekin uske baare mein kya kar sakte hai? What can I do about it? This is where hamara soch ko badalna chahiye. We have to change our pattern of thinking. And in that moment, we have to try to bring it. So it takes time. See, I talk about it every place, but when I have a problem, I also get upset. So then I have to tell myself, Ananda, whatever advice you are giving others, you give yourself. Huh? You have to give yourself that same advice. That is also Vairagya, metacognition bolte. When we talk of stress, हमारा दोस्त बीच में बहुत गालियां देते. Friends when they meet, इतना तो बुरा गाली देते. You don't get upset. You feel very happy. Dost hai. You have that feeling that this is a sign of your closeness. But if you are driving on the road and someone says that one of those gali, you will get down and beat up that person because he is not considered friend. And this is why what we need to do is we need to develop that capacity to see the good even in the problem. This is again Pratipaksha Bhavanam. Pratipaksha Bhavanam is the best way to change our perception of stress. When something happens, try to understand what is the lesson that you are learning rather than say, oh my God, this is so bad. What is the lesson I am to learn? What is it I am to learn? How can I change so that next time I don't have this problem? This is where yoga comes alive in our life. Is there any method to recognize swell in neuro ICU patients? Well, we haven't developed a method because what we do normally is we ask the person to breathe and tell us, or you can use a glass, one of those glass pieces that are used in labs. a slide, a glass slide. You put the slide and you blow. And you can see which side the swell is there. So even in Neuro ICU, you can take a glass slide, you put it there, and as the person breathes, you see which side is getting fogged. Because under to AC hai, the breath will be warm. So the glass slide, you'll start to see the fogging. So you can understand it. And you can then change the swell by shifting the position. Because when you turn, if I turn to the left with right up, now it will become the Pingala swell. If I turn to right with left up, it will become Ida swell. So even if you don't do all your crutch and all that, just lying on the side, we call it Surya Nadi Asana, Chandra Nadi Asana. So Chandra Nadi Asana mein left side upar hai, Surya Nadi Asana mein right side upar hai. That is what you have to remember to do. How does yoga heal gum issues and eye floaters? This is quite a question. See, basically, what I will say is that all of these are issues that are coming from degeneration and deterioration of our body functioning. All of this is deterioration and degeneration. Because for the first part of our life, we go into the growth phase. So when we are a child, we are growing. So graph to upar jata. After some time now, earlier it was after 60, it starts to come down and all degeneration starts to occur. Aajkal kya ho gaya? 2030s mein degeneration shuru ho gaya. Because of the stress. First factor to stress. Dusra, unhealthy lifestyle. Teesra, unhealthy diet. And what has happened is, instead of deteriorating after 60, after your Shashti Abda Purti, you should degenerate. Not before that. We started degenerating after 20th birthday. Young people, 20, 22, 24 are dying of heart attack. What is a heart attack? A blocking of the coronary vessels. What is that? It's a type of deterioration, degeneration. So all I will say is, when you start practicing pranayama, pranayama is the best way to deal with deterioration. Because prana shakti कम होने से डिटोरिएशन होता, डिजेनरेशन होता. प्राण शक्ति ज्यादा होने से रीजनरेशन होता. So the whole thing is, you can consider all of this as a loss of the prana, going into the final stage, which is aprana, which is death. Aprana का मतलब है तो मर गया. So we are going from prana to aprana. You can retrace it by enhancing the qualitative aspect of prana. How do you enhance prana? Pranayama. क्योंकि pranayama का मतलब है breathing exercise नहीं है. Breathing exercise नहीं है pranayama. Pranayama तो प्राण को awareness को ज्यादा होने से enhancing the prana. How you are enhancing the prana? By becoming aware of the prana. Prana तो सब जगह में है. It is in the air, it's in the water, it's in the food. Every place is prana. But what has happened? We have shut the door. We have shut the window. Surya Bhagavan to bahar hai. Hum andar to curtains laga ke baita. So we say, oh, there's no sun. Sun is there. Prana is there. We are not connecting. Reconnecting to that prana is pranayama. So don't worry, is it Anulom Vilom, Kapalbhati, is it Bastrika, is Kapalbhati, Pranayama, all this, you leave all of that. What is most important? You start working on awareness of prana. Now, prana dharana. Prana dharana hona chahiye. It should become prana dhyana and prana samadhi. And in between, you will have a prana darshana. Darshan of the prana. Then all of this will set right. So simple thing is, start work on pranayama. In mental depression, what to do? In mental depression, the major issue is that we need to start breathing healthy. It is very clear. If you look at the Hatha Pradipika, yesterday I was giving a course on Nada Yoga. And Hatha Pradipika in the chapter on Samadhi, Pura hai Nada Anusandhan. And the importance of Nada to work with the prana, the laya, and all of that. If you want to work on the mind, you have to work on the breath. And the best way to work with the breath is the use of Nada. And we do a pranayama here with all our patients called Pranava Pranayama, which is based on our tradition, where we use the akara, ukara, Makara and Omkara Nada. Where you breathe and then you breathe, then you breathe, and you bring it together. And the Stula Sharira, Akara, Sukshma Sharira, Ukara, and Karana Sharira, Makara, come together into that Omkara, coming into the state of oneness. Why are we depressed? Because we think we are alone. So we feel lonely. But when you do the pranava, you connect to Ishvara. Tasya vachakaha pranava. You connect to the Ishvara. You know, I am not different than Ishvara. What is the difference between Ishvara and us? Klesha karma vipaka, nothing else. So, if Ishvara has klesha karma vipaka, Ishvara becomes us. If we take out klesha and karma vipaka, we become Ishvara. Formula बहुत simple है. Maharishi Patanjali का formula है. What he says? Klesha karma vipaka ashayai aparamrishta purusha vishesha Ishvara. So, we are Ishvara. But why don't we know we are Ishvara? Because of klesha karma vipaka. So eradicate the klesha. That is what Kriya Yoga Sadhana comes in. And Pranava is the best pranayama that we use for all our patients, helping a lot with depression. Again, Brahmari Pranayama, any of the Nada Anusandhana practices, they will help a lot with mental health. And do you feel Prarthana can lead to Pratyahara? Badhiya hai. Good question. See, Prarthana, your life should be your Prarthana, okay? Your life should be your prayer. Your life is your Prarthana. Not what you ask from somebody. What you ask is not Prarthana. Prarthana is your life. Many people, oh, I want the world, Loka samasta sukhino bhavantu, bolte, uske baad sabko marwate. No, that is not. It is so important that we need to get to the root. What is the root? You have to understand that your life should be your prayer. When your life becomes your prayer, not only pratyahara, it will become samadhi also. When your every thought is for the welfare of humanity, when your every word is for the welfare of humanity, when your every action is for the welfare of humanity, what will happen? Automatically, dharana, dhyana, samadhi, sab ho jata. Kaivalya bhi mil jayega. Kaivalya bhi mil jayega. How do we overcome tic disorder? टिक डिसऑर्डर का मतलब है हमारा न्यूरोलॉजिकल सिस्टम हाइपरएक्टिव हो गया. So इसके वजह से sudden movements will be there. So the person will be like that, and then every now and then ऐसा एक movement, repetitive movement will come in and they cannot control it. What we have found is a very important practice, Brahma Mudra, where we move the head to the right, then we move the head to the left, we move the head up, and we move the head down. And Hamara tradition mein uske saath we give the bija mantra. So when we are coming back from here, it is with the sound of from here. Here we add a different sound E, and here so you have the A, U, Ma, but you have an extra sound E. E ka sound kya hai? Hamara pineal gland stimulate ho jata. Im. The bija becomes im. E becomes im. So the A, U, E, M. When you bring the sound, the breathing, and the movement, this is helping to bring a tranquility for people who have tic disorder. And there is some success. I won't say pura cure ho jata, aisa nahi bolenge, but success hai, definitely some level. Science of Nadi Yoga. Nadi Yoga ke baare mein abhi I am conducting a 7-month course. Every Thursday एक क्लास है, and अभी 3 क्लास हो गया, क्योंकि इतना है उसपे. लेकिन only one point I want to give you. Nad is not just making the sound. Nad is the pure vibration. That is the anahata nad. So everybody thinks I go around going cling, boom, bang, ginga, and it's nad. See, uska anahat nad to you want to go. Hamara goal kahan hai? Anahat nad, which is the nad of Ishvara itself. See, Patanjali says, he's very clear. When I say Patanjali, you add Maharishi, because for me, he is the topmost, okay, always. And for me, he's not in the past, he's from the future. Future say he has had time travel. क्योंकि उनका teachings तो इतना relevant है, हमेशा relevant है, हमेशा relevant होगा. They were, they are, they will be, because इतना timeless teaching है. But he says, tasya vachakaha pranavaha. So Ishvara ka, he says pranava. So we said, oh, the name of God is Om. So immediately हम लोग क्या बोलते हैं, NASA ने बोला sun is making the sound Om Om. ऐसा मतलब we get very caught into it. See, Nad, the sound of Ishvara is beyond our comprehension. हमारा sound क्या है? 20 to 20,000 hertz है हमारा hearing का level. 20 to 20,000. 20 के नीचे वाले frequency हम we cannot hear it. 20,000 के ऊपर frequency we cannot hear. So you cannot hear the universe frequency, okay? Sound of the universe we cannot hear. हमारा capacity नहीं है. लेकिन what Maharishi Patanjali means is the closest human sound to that is Pranava. Not that Pranava is sound, because you cannot hear it. But you can make a sound. What is that sound? Oh. And when you make that sound, what are you doing? You are creating from the lower, you are creating an energy, a prarthana, a sankalpa that then will vibrate at the anahat nad. So anahat nad is the goal. The ahata nada is our methodology. We are using the methodology to create the effect. So in our tradition, we use the pranava as a very important technique. We have practices like Shabda, Pratyahara techniques to understand Nad and its relationship, the importance of Brahmari, and so many other practices. But if not anything, sit quietly and try to listen to your heartbeat. Try to listen to the breath as it comes in. Hum, sa, so, hum. And hear that so, hum. As the breath comes in, so, and become aware of that. That type of aspect is very important.
सर आप म्यूट हैं.
Thank you very much, Dr. Anand, for your pearls of wisdom. Unless one lives such life, such words cannot come out. And just to summarize, Dr. Anand has started his journey of this workshop with the 2 points. First one is Yogic Chikitsa, wherein he has clearly made clear that pathogenesis, genesis and salutogenesis. आरोग्य क्या है, स्वस्थता क्या है. He has made it clear and beautifully. Illness to wellness, that concept he has to give. And that is why he said that health is a dynamic state. It is not a static state. It is a dynamic state. When he was talking about this yoga therapy, he said that alternative, either you or me. And if complementary, there's also problem, and therefore there's a need of integration. And that is the reason why he brought in the WHO, wherein the acceptance of this additional complementary, what you call integrative medicine, the concept has come. He was, I think that no one knows that, but he was struggling with this point for the long period. And he wanted to establish, and WHO has accepted this traditional complementary integrative medicine, and now it is being accepted all over the world because WHO has accepted. He has also talked about the East and West and how the yoga is being accepted all over the world. He has put the point of UK, also put the point of US, how it is increasing even though he said that 6,592 articles on yoga are published in PubMed, it is a surprising that how it is increasing to that extent. Now he never forgets the obligations, or he feels obliged. At the end of his namaste, he said that gratitude is very, very important, And he said that his mentor, Dr. Madan Mohanji, who is a well-known physiologist, and he has also talks about the various books, various authors. His book also, but at the same time, he has mentioned the name of the various books that can be refers. And he said that the only thing is the communication is very, very important, just to be taken care of. And whenever we are talking about yoga, when he gave the definition of this yoga and yoga therapy, he showed you this, what you call the one circle, in that circle, yoga was also written and yoga therapy was also written. In that, it is very, very clear that principles of yoga that are to be understood, not only asana and pranayam, it is not that. So the whole principles are to be taken care of, wherein he has made clear that health and wellness being within the therapeutic aspect, that should be there. He has made it clear. When he was talking about the stress aspect, I was fascinated for that, because he said that yoga is a vaccine for this stress, And suppose if you are suffering from stress, then it is an antidote, and there's no doubt about it. So it was very. At the same time, he talks about Yoga Vishishta, and he has also given you the example of Rama, how he was in a despondency state of mind, and also about the Arjuna, So and how this stress works. What is the mechanism he has also mentioned because that is the 4 stages, how it works. When he was talking about the psychic stage, he said that it is a Vijnanamaya kosh and Manomaya kosh. Because of the disturbance in these 2 koshes, there is a psychic, just something is happening, he said. And thereafter, he was talking about the psychosomatic, wherein Manomaya kosh and Pranamaya kosh and Manomaya kosh is involved in it. And thereafter, his somatic state, he said that this is a pranamaya and annamaya. An organic state, now it is established on the body level. Now you have to, without this pathology, it cannot be. So how this stress works in our, what is the mechanism? And also he talks about how to overcome this mechanism, how this can be regulated and re-channelize the flow of our energy with a view to set right our, because it is a default setting. When stress takes over, then it is a default setting, automatically it leads you to this state. And thereafter, what happens if you change the flow? Then beautifully it is said, the person who has brought in the concept of stress, he himself has said that it is not stress that kills us. Beautifully, Dr. Anand has said that it is our perception. And hence, Shale also talking the same thing. It is not stress that kills us. It is how we react to the stress. It is a perception. Beautifully, Dr. Anand has made it clear. And stressors, according to Anand, according to our scripture, is vitarkas are said to be the stressors, And what is the treatment for that? What is the Pratipaksha Bhavana only? There's nothing is there, without that. So he was also talking about many other things, but at the same time, he stresses upon the how to put it in a practice. This is a very, very important for all of us, because it is to be understood properly and it is to be implemented, applied properly. Then only we can, whatever he has said, then only it will be justified, otherwise no. So how to put it in practice, that was a great aspect that is to be kept in mind. He has also took the name of Dr. Dilip Sarkar. We all know him also because he was a surgeon. His heart, what you call the surgery, open heart surgery was there, and after that he left everything and he came into this. Has written so many things, and he is also lecturing everywhere. He is a good friend of Dr. Anand, and Dr. Anand considered him as a elder brother also, because I have heard from his mouth that many times he is also. Most important, the first part of his lecture and the end slide when he was presenting egological and ecological, which was fascinating, So that was very, very important. We have to think over it, and it is not only a few exercises, what we are doing can help us to overcome all this, and we have to take care of the environment also. This is what beautifully. The second part of his talk, it was again, there are few new things for the yoga therapist, I think, and he has all brought it in his book, Yoga Chikitsa. That book is also available. It is published. So those who are interested can have this book, can write, you will be able to take this book. The most important, the diagnostic tools, which is yogic diagnostic tools, wherein has talked about the Dwadash Rog Lakshana Anukrama. That is very, very important. So, and he has given us various aspects in Yoga Vishishta. He has given us also the Chaturvyuha of Patanjali, and Chaturvyuha is also the Buddha's four noble truth of Buddha's also, and the Pranavayu, and also the Chakra, what you call the models, also given. He has given also Swami Kuvalananda, who was the pioneer in the field of research, scientific research, who has also given us the strategy, how yoga, that is the route, with a view to diagnose the problem and to overcome. Cultivation of correct psychological activities, reconditioning our neuroglandular system and other systems also, appropriate diet, and how to eliminate. This is a very, very important. And Dr. Anand, beauty is that in the beginning, when he started presenting the second part of his talk, he immediately said that this was prepared by so and so. How he is, what kind of person he is, that is to be understood. There are people who are writing articles, but nowadays there's a plagiarism. You call the software is there, on the basis of which we can say that who is taking from whom. So that is also clear nowadays. But so you see, this is what is to be learned from such people, those who are living this yoga in their day-to-day life. He has also talks about the darshanam, sparshanam, prasanam, and everything. And at the end, some practical problems in assessment also he has discussed. So, Dr. Anand, I am from the core of my heart. You are not only a speaker for me, but you are in my heart, that you know well, and my staff members, my students, my whole university knows that you are advisor of our department, of our university, and time and again, the way you accepted our invitation for this workshop, this lecture. I wish that in the future also you will help us, and I wish that my staff members also in the grooming state, and they will also learn so many things. So keeping that in mind, you will help us in the future also like this. Thank you very much once again. Thank you. Namaste.
Dhanyavad, Sharma ji. Thank you for that beautiful summation of everything I said in such a beautiful way, with your own that jnana that flows through you. It was such a beautiful experience, and I'm always honored to be part of the advisory team for the Sri Sri University. I am looking forward to coming there in the near future physically to be with all of you. And we invite all of you to visit here, Pondicherry, the site of SBV, and hopefully there can be some MOUs and some interactions.
Yes, I was thinking that, Dr. Anand, regarding the MOU that I wanted to
Yes.
discuss, but not at this platform.
Yes, yes.
On the basis of that, I would like that my students may visit sometime.
Yes.
My teacher may visit sometime, because
Yes.
they are also in the grooming state. So
Absolutely.
they must. So likewise. So now at this moment, I take a moment, Dr. Anand once again, and request Dr. Anjala Devi ji to propose a vote of thanks.
Yeah. A graceful, a warm good afternoon to our eminent speaker, today's eminent speaker, Yogacharya Dr. Anand Yogi Bhavanani sir, and respected Dean sir, Professor Dr. B.R. Sharma sir, and our colleagues, very specifically our dear students and participants. Last but not least, all of gathered here. First of all, I express my thanks to given this opportunity to propose vote of thanks in this auspicious program. First of all, I want to thank to our eminent speaker, a rich, valuable source. He said a lot about yoga and yoga therapy. Deans are also nicely, he has summarized. I think it's very useful to all of us. I enjoyed this program. Thank you so much, sir, for your wonderful time. Really, thank you so much. And next, I want to express my thanks to our Dean, sir. Nicely, he guided and helped to organize this program. Really, thank you so much, sir. And I want to thank to my colleagues nicely with a healthy conversation, healthy discussion. They organized this program. I want to thank to them also behalf of our department. Very specifically, this rich source not able to transfer to the society without audience. I want to thank to our students and all our participants. Thank you so much for all. Thank you one and all to present here. Thank you so much.
सर आप म्यूट है.
I think that before leaving, the last words you have to advise my staff members.
You have asked me to give advice. I normally try not to give advice because nobody listens to advice. But what I would like to share is that you have an opportunity to teach so many people. You have an opportunity in a prestigious institution to be a role model for the students who come to you. Never forget the importance of a teacher as a role model. What you say, they will forget. But what you do, they will remember. What you are will change their life. In my own life, my teachers have been role models of what to be. I have learned from them what to be, and then the rest of it will happen on its own. Because in life, to be a teacher is a big blessing. So make sure you are equipped. Keep reading, keep attending seminars, keep looking at what's new coming up. Try to understand the old tradition, timeless Puradana tradition of yoga. Put it in a modern context for the young people. Because the young people, they need to understand it in a modern way. But don't let it get disconnected from tradition. In trying to become modern, we shouldn't lose tradition. So as a teacher, be a role model. Remember, your students are watching you every moment and they will imprint on you, and be up to date. And I think honesty as a teacher is very important. If a student asks a question and you don't know the answer, don't try to bluff. Tell them, I don't know the answer. I will find out the answer and share with you. And every time I have done that in my life, I have learned something, that student has learned something, and we have built trust. They know that Dr. Ananda will not bluff. If I don't know something, I'll say I don't know, but I don't leave it there. So please keep on trying to have that honesty. And that is why we should always acknowledge those who have contributed to our success, share with people, and remember, we are blessed to be in yoga. To be in yoga, to be in this field, to share this field, it's the biggest blessing. So we owe it to our mother, our divine mother, Yoga. For me, mother is my Yoga is my divine mother. We should always respect her, love her, and make sure that we are the best ambassador for her. That is the message I will give.
Thank you, Dr. Anand. Thank you very much. And time and again, we are going to give you trouble, and
it's never trouble, Ji. It is
you.
an opportunity.
Thank you.
So looking forward to
Namaste.
meeting you all later. Thank you so much for today.
You
Dhanyavad.
have to physically, you have to come now. Sometimes
Yes.
we have to talk out a program, and physically you have to come. Thank you. Namaste.
Definitely, Ji. Thank you, Ji.
Thank you. Namaste.
Thank you. Namaste.